Good evening, everyone. Uh, Prior to this session, I had spoken on research designs, observational research designs, and I also had asked you to email Dr. Kavita Raja if you have any doubts with qualitative analysis designs. Now, coming on to this session on randomized control trials or experimental trials, I want to make it clear to you all that a randomized control trial is a part of experimental design. Most of you would have heard of randomized control trial or just clinical trials as an experimental design, but experimental designs have many kinds of trials. And now it is necessary at this point of time to know what is a clinical trial. This figure shows you different classifications or different classes of experimental designs. Most of you know about control trials. You know about studies with no controls. You know randomized and non-randomized control trials. You may not know about self-controlled or crossover trials. Now, sequential trials are something which are used in quality management, and most of you may not have heard about it. But now slowly this design is percolating in rehabilitation studies. A clinical trial is a prospective study in which you compare the effect and value of interventions against a control in human beings. Now the purpose of clinical trials may vary. Some of the researchers, they do it for patient management. They conduct clinical trials for patient management. It is performed by pharmaceutical companies to know which drug is better. Randomized control trials are used in marketing, and it's also used in biomedical research involving human subjects, where the companies or the researchers are trying to improve the validity of diagnostic, therapeutic, or prophylactic procedures, or when they want to understand the etiology and pathogenesis of the disease. Now, in patient management, the researchers want to elucidate the most appropriate treatment for the future patients. Now, all of you have come to know why there are clinical trials. Now, clinical trials fall in broad two categories, that are with controls and those without controls. Now, controlled trials are those kind of research designs where experimental drug or procedure is compared with another drug or procedure, or sometimes a placebo, or sometimes the previously accepted treatment. Now, uncontrolled trials are those studies in which the investigator uses his experience with the experimental drug or procedure, but the treatment is not controlled with another treatment or placebo. Now, when you distinguish between the controlled and uncontrolled trials, studies with controls are much more likely to detect the difference in the experimental treatment in comparison to placebo or the older drug than without controls. So we can say that the control studies have greater validity in physical medicine and rehabilitation than uncontrolled studies. Now, in order to improve the reporting of controlled and uncontrolled trials, the consort group, that is Consolidated Standard of Reporting Trials, have given guidelines to improve the reporting of clinical trials. A comprehensive discussion of this consort guideline is done by Altman and colleagues in 2001. Now, if you look at this figure shows you control trial. It will show you a big a big circle, which means this is the subject pool, and that's where the study has started. Now, according to the inclusion criteria, the subjects will be allocated to experimental group and control group depending on randomization. Now, if you look at the onset of the study and then you see some few crosses, that denotes intervention. So after the subjects have been allocated to experimental and control group, after randomization, they undergo intervention. Controls may undergo placebo treatment or some other drug, and experimental groups undergo treatment with the drug in a drug which is in question or which has to be proved to be efficient. Now, after the end of the trial, the subjects, both the experimental and the control group, will be looked for outcome. Now, there can be outcome after giving experimental drug in experimental subjects, or there may be no outcome. Similarly, in controls also, there may be outcome with the placebo or there may be no outcome. The analysis of this kind of designs will be discussed in another webinar. One way a trial can be controlled is to have two groups of subjects. That is, one that receives the experimental procedure and the other receives the placebo or standard procedure. The experimental and control group should be treated alike in all the ways except for the intervention, so that the differences between the groups will be due to intervention and not due to any other factors. Now, the best way to ensure that the groups are treated similarly is to plan interventions for both groups simultaneously or within the same time period, so that the study achieves concurrent control. Now, blinding is an option which reduces the chances that the subjects or investigators see what they are expecting to see. The researchers can design double-blind trials in which neither subjects nor investigators know whether the subject is in treatment or control group. By the way, the best method of assignment of experimental and control group in randomized control trial is randomized assignment. Randomized control trials are the strongest evidence for concluding causation, and these studies indicate that the result is due to intervention and not by chance. Um, an example which I can give you here is there was a study done on physicians where the physicians took aspirin and the outcome was myocardial infarction or the frequency of myocardial infarction. Here the investigators found that the physicians who were taking aspirin experienced less myocardial infarction during the course of the study than did the physicians receiving the placebo. Now, studies that do not use randomized assignment are generally referred to as non-randomized trials or simply as clinical trials or comparative study with no mention of randomization. Now, you would have looked into a journal article. Usually when you are preparing for a journal club, you must be looking for clinical trials or randomized clinical trials, and you may or you would have bumped upon an article which does not give you the procedure of allocation or randomization. They just have an experimental group or a control group. Those kind of studies strictly do not fall into randomized control trial, and therefore they are known as non-randomized trials. Studies using non-randomized controls are considered to be weaker because they do nothing to prevent bias in patient assignment. And we know that the bias is minimized by randomized assignment. Now there is a trial, something called as trials with self-controls, where the researcher is putting the experimental group as controls after a certain amount of washout period. It provides moderate level of control, and it can be you can use the same experimental group for control options also. An example which I can give you here while talking about self-controls is there was a study done where the follow-up had occurred at first and third month after cholecystectomy to detect changes such as abdominal pain, flatulence, and dyspepsia. So this kind of study uses patients as their own controls and is called as self-control study, because after 3 months, after 1 and 3 months of cholecystectomy, you are trying to find out the outcomes. Okay, so once cholecystectomy has been done, these experimental subjects become their own controls. They become controls in the study. The problems in trials with self-controls are that there may be an effect known as Hawthorne effect. The Hawthorne effect was described by Ruth Ellisberger and colleagues in 1946. Now, um, this Hawthorne effect is not a great effect, but suppose if you have divided patients into experimental and control group, and you are giving some medication or rehabilitation treatment or cognitive therapy or something like that. So the people's behavior changes and sometimes it improves because they have received attention by the researcher and not because of the study intervention. So these studies are similar to cohort studies except for the intervention or the treatment that is involved. So trials with self-controls are prone to have Hawthorne effect. The self-controlled study design can be modified to provide a combination of concurrent and self-controls. This design uses two groups of patients. One group is assigned to the experimental treatment and the second group is assigned to the placebo or control treatment. And then after a time, the experimental treatment and placebo are withdrawn from both the groups for a washout period. These kind of studies are seen in exercise physiology where experimental group is now becoming a control group and control group is becoming an experimental group after washout period. During washout period, no procedure or treatment is given. The groups are then given alternative treatment, that is now the first group receives the placebo and the second group receives the experimental treatment. These kind of designs are known as crossover studies and they are powerful when used appropriately. Now this figure shows you the trials with self-control and or the crossover trials. Here you would see the pool of the subjects, then randomization is done into experimental and control group, and then they are looked for outcome, and after a period or washout period in which no treatment is given, there is reversal in the experimental and control group. So now the group which was allocated to experimental group is now made as control and the subjects who were in controls have now become experimental, and then intervention is again given or a procedure is again given, and then the outcome is noted at the end of the trial. Trials with external controls. Now here are the studies where the investigator has not recruited a control group in the study, but now he's using control group from previous studies or historical studies. The controls are the patients the investigator has previously created in another manner or the results of the previous studies called as, they are also known as historical controls. Now, historical controls are frequently used to study diseases for which cures do not yet exist and are used in oncology studies. Although many of the oncology studies use concurrent controls when possible, but you can take up previous data or previous studies and make them as controls for the newer treatments. In studies involving historical controls, the researchers evaluate whether other factors may have changed since the time, because the historical controls would have been treated like in the past where where the situation would have been different. There would have been less technology, there would have been less advances, and now the researcher is using these historical controls with the newer procedures where the situation is different and the technological advances are greater than that historical time. So sometimes it may be possible that there are differences due to other factors and not due to the intervention. Now, uncontrolled studies involve interventions and have got controls, but they really do not belong to experiment or trials. Uncontrolled studies are more likely to be used when the comparison involves a procedure than when it involves a drug. The major shortcoming of uncontrolled studies is that investigators assume that the procedure used and described is the best one. Now, the disadvantage of uncontrolled study is that the investigators assume that the procedure is the best one, and the way they are performing is again unmatched or unparalleled. Unproved procedures and therapies sometimes can become established with these kind of studies, and it sometimes percolate in the research studies and comes out to the textbook where the readers understand that these procedures are actually beneficial, but they have not been proven to be beneficial. Now coming to the last group of experimental designs, which are not really experimental designs per se, but they are meta-analysis and review of the papers. The studies that do not fit specifically in either category of observational study or experiments, they are placed into meta-analysis, and meta-analysis uses systematic reviews with mathematical analysis and pooling of similar subjects, experimental and controlled subjects, and then statistical analysis is done to give out information after pooling whether the particular procedure or the drug is useful or not. Meta-analysis uses published information from other studies and combines the results so as to permit an overall conclusion. Meta-analysis is similar to review articles, but it has quantitative assessment and summary of findings, something like Cochrane collaboration. Meta-analysis of observation studies or experiments can be undertaken, but meta-analysis of observation studies should not be combined with experimental studies. Therefore, one meta-analysis reports only on observational studies or experimental studies separately. Coming to the conclusion, the experimental studies may be broadly classified into controlled and uncontrolled studies, and controlled studies may be further divided into randomized controlled trials. They may be crossover trials, or they may be trials with self-controls. Sequential trials are something where the sample size has not been determined. The subjects are just placed into experimental and control group depending on their availability. And this trial usually continues till the effect is seen, or one concrete result is seen during the procedure. Now, these kind of trials are not used in human beings. Sequential trials are not particularly used in human beings, but they are used for development of drug in animals. So this finishes the types of study designs or the research design. If you have any doubt, please put an email to me and I would reply. Thank you very much. Good night.